Hello and welcome to our show, Health and Wellness, Myths versus Facts. I'm Gargi Rawat. Now, hormones affect everything from blood sugar to blood pressure, growth, fertility, sex drive, metabolism, and even sleep. Hormones are essential for life and your health, and one such hormone is insulin. Insulin is a key factor in the development of diabetes. Although the discovery of insulin in 1921 revolutionized the treatment of diabetes, inadequate access to insulin and diabetes care remains a problem in many countries a century later. Insulin usage and its role in diabetes management are surrounded by various myths. There are eminent endocrinologists with us today to help us learn more about this and so to help you better manage diabetes as well. We're joined by Dr. Adeline Reena Solomon, a consultant endocrinologist, Sundaram Medical Foundation, Chennai. Dr. Shivani, Assistant Professor, Endocrinology and Metabolism, AIIMS, Bhatinda, and Dr. Sunetra Mondal, Consultant Endocrinologist, Health World Hospitals, Durgapur. Thank you so much, doctors, for joining us today on the program. Dr. Solomon, first to you. Hormonal balance is essential for the normal functioning of the body. How does an imbalance of insulin then affect the body?
So insulin is the key player in maintaining the blood glucose level in the human body. So what normally happens is the moment the blood glucose goes up, the signals are sent to the pancreas, which starts releasing insulin in appropriate quantity, matching the blood glucose spike. Now, the moment the insulin is released, the insulin helps the glucose in the blood to enter into the cell, which is used for the breakdown and the energy release. So this kind of helps to bring down the glucose levels in the blood and therefore maintaining the glucose level in the normal range. Now, what happens in conditions where the insulin levels are very less or very negligible, as we encounter in type 1 diabetes and probably in the later phases of type 2 diabetes as well, is that because of lack of insulin, the glucose does not enter into the cell. Therefore, it remains in the blood circulation, contributing to high blood glucose levels and hyperglycemia. On the other hand, in the early phases of type 2 diabetes, we have insulin, but despite being available, the insulin does not exert its action on the cell, again contributing to a high blood glucose and hyperglycemia. So altogether, insulin is a very, very essential hormone that helps the balance of glucose levels in the blood and helps in the overall functioning of the body.
All right. Now, Dr. Shivani, does insulin therapy lead to weight gain? Because this is a concern. What other methods are there to manage this weight gain?
Yeah, if we give insulin in the patients who having type 1 diabetes, these patients are already insulin deficient. When we replace them with the insulin, they will lead to catch-up weight regain. That is the weight they have lost because of high blood glucose level. That is, again, they will put on that weight only. Even when we give insulin to the patients with type 2 diabetes, the weight gain is around 2 to 3 kg over 5 to 6 years. So there is minimal weight gain, but the glycemic control, that is blood sugar control, which is better with the insulin, overweight the risk of this small amount of weight gain. And it has been seen that the weight gain is more in the patients who have previously poor glycemic control, those who have sedentary lifestyle, those who have poor dietary habits. So weight gain can be minimized and even weight can be maintained if the patient break these habits, if we keep a check on the energy intake, keep control on its portion size, what the patient is eating, and at least do 150 minutes of exercise per week. So that exercise should be at least moderate intensity, aerobic exercise. So with these methods, they can maintain their weight, but weight gain is minimal, and that is usually the weight that patient has previously lost due to poor glycemic control.
Now, Dr. Mondal, people with type 1 diabetes and some people with type 2 diabetes may need to take insulin every day. Does taking insulin make daily life less flexible? And is the daily use of insulin safe?
Okay, so as we heard, the very important hormone of insulin is secreted from our pancreas, the beta cell. So those with type 1 and some patients with type 2, say those with long-standing type 2, have a failure of their beta cells. So they don't have any insulin. So insulin is the correct and many a times the only treatment available for these patients. But of course, insulin is given in daily injections, subcutaneous injections, and therefore it might seem like bargaining your quality of life with staying healthy and staying alive. But then if you look at the commonly used insulin regimen, the basal bolus regimen, so one, the basal insulin is taken at a fixed time of the day, usually at night, and the bolus insulins are taken before any meal. So just like we don't have to remember taking our meals every day, it's not very difficult to remember taking the insulin as well. There is another, the premixed regimen, that also is quite in sync with taking the meals. So there is lesser chances to forget. What's more is that nowadays we have newer insulins like long-acting, ultra-long-acting insulin, which can be taken any time of the day, unlike a fixed time. And also there are ultra-short-acting insulin, which can sometimes be taken even after a meal. So in case somebody cannot take a meal because of their erratic meal schedule or lifestyle, so there is a chance to omit that insulin as well or take it after the meal. Again, there is something known as insulin pump, which has actually revolutionized the life of people who are taking multiple daily doses of insulin. It is a device fitted on the body, which is keeping track of your blood glucose throughout the day and changing the delivery, the dose of your insulin according to it, according to your diet, according to your exercise. So you don't really have to think at all about your quality of life with the insulin pump.
All right, Dr. Solomon, what factors affect the type and the amount of insulin that a person needs?
Several factors contribute to the need of insulin and the dosing of insulin. First and foremost would be the age of the individual. So depending on the age and the body weight, the dosage of insulin would vary. The more obese the individual is, the more the insulin requirement would be. Longer duration of diabetes demands more insulin because we know that the beta cells in the pancreas have been lost by then, and therefore it has to be completely replaced by insulin from outside. Associated problems and complications like renal kidney disease, liver disease can demand a fluctuation of glucose and therefore need more insulin in some cases and probably less insulin in some more cases. And associated other problems like whenever patients are on concomitant drugs like steroids or chemotherapy, these are the medications that can increase the blood glucose and therefore may warrant a higher dose of insulin. Now, having said that, beyond all these factors that I've already mentioned, the glycemic control at the time of diagnosis, at the time of therapy, the insulin resistance component in the given individual, and the target glucose that one would want to achieve in the given individual also contribute to the insulin requirement. Now, having said that, the insulin requirement and dosing would change over a period of time, even in the same individual, and therefore it becomes very essential for people with diabetes, especially those who are on insulin, who would require a very close monitoring of blood glucose, and therefore we will be able to adequately titrate the dose of insulin and probably help them in achieving a better glucose control as well. So there are several factors that contribute to the high blood glucose and therefore the need of the insulin dosing as well.
All right, Dr. Shivani, can the need for insulin change over time? If you could explain to us, does this happen and why?
Yeah, insulin requirements changes with the time, as rightly said by the Dr. Solomon. And there are basically two types of insulin. And not only time, and with the different situations, insulin needs to be changed. There are mainly like two types of insulin: basal insulin that is released throughout the day, and that keep a check on the small amount of the blood glucose level fluctuation throughout the day. And there is prandial insulin that keeps control the meal related rise in the blood glucose level. So if the patient changes its activity, like if the patient do excessive workout, if the patient do excessive exercise, the change there is need to change the basal insulin dosage. And if there is change in the meal content or meal timing, then prandial insulin needs to be adjusted. Even during the different phases of life, like if the patient enters into puberty, or the patient conceives and get pregnant, then also the insulin doses and regimes needs to be changed sometimes. And if the patient gets sick, or the patient gets hospitalized, or the patient requires surgery, in all these situations, the insulin doses needs to be adjusted according to the blood glucose levels, and to prevent the excessive rise in the blood glucose level or development of hypoglycemia. So it's not that insulin doses are always static. It needs to be changed if the patient gains weight or the patient loses weight. So all these factors contribute to change in the insulin doses as well as regime.
Now, Dr. Mondal, if you could explain to viewers what is basal insulin and what is bolus insulin?
Yes, so there are different regimens of insulin, and if you're talking about the most near perfect insulin regimen, it is the basal bolus insulin regimen because it mimics the normal physiologic insulin secretion in our body, as very nicely explained by Dr. Shivani. So the basal insulin is a long-acting insulin. Many a times it is peakless, which takes care of your 24-hour blood glucose and keeps your pre-meal, the before meal values under targets. But the bolus insulin is a short-acting insulin. It has a peak, and this takes care of the post-meal surges in blood sugar that you may be having because of your meal. And it is a short-acting insulin. It has a peak some 30 minutes, 1 hour after a meal, and its action wanes off after a little time.
All right, well, we'll slip into a short break now, but return with more questions for the doctors about insulin and diabetes management. Stay with us. Welcome back. You're watching Health and Wellness. We're talking about diabetes management and the role of insulin. Let's go across to our panel of doctors. And Dr. Solomon, what are the new advances in delivering insulin into the body? In recent years, insulin pumps have become more popular. And we've also heard that they have better efficiency than regular insulin injections. So if you could explain this.
So normally the insulin that is secreted from the pancreas reaches the liver first and exerts most of its action on the liver. This is very important for the efficacy of insulin. And what happens when you really give insulin from outside as an injection? We inject the insulin injection into the fat plane, which is underneath the skin, and hence that needs a bit of time to get absorbed from the fat into the bloodstream to exert its action. So that is the reason why the insulin doses and injections are given few minutes before the meal that is consumed. Now, having said that, this has been the standard way of insulin administration ever since the first clinical use of insulin was done, which was almost 100 years ago. Now, insulin pump is a very good new device that helps in terms of insulin delivery, which is a small device that is attached to the body that has a pre-programmed schedule to deliver the insulin dosing. Now, this insulin pump is again very similar to the conventional insulin administration, but the advantages being that they do not have multiple pricks that is otherwise given with the subcutaneous insulin. They offer much of flexibility, better sugar control, and as well as less of hypoglycemia, which is the low sugar control. Now, there are other modes of administration of insulin therapy, which include the inhalational mode and the oral forms that are still in research and are not currently in clinical use.
Right. Dr. Shivani, what does home blood glucose monitoring play? What role does it play when you're taking insulin injections daily?
Yeah, home monitoring of blood glucose is very important to achieve the good glycemic control. It can be done with the glucometer, simple glucometer that are available in the market freely, or it can be done with the continuous glucose monitoring devices that checks the blood glucose every 5 minutes and give you a visual graph of blood glucose readings. But we advise the patient to do how they should do home monitoring of blood glucose. They should check the blood glucose at the different times of the day, like they have to check the blood glucose during the fasting, before meals, 2 hours after the meals, in the breakfast, in the lunch, in the dinner. Not they have to check all the blood glucose daily, but they have to check different blood glucose during the different times of the day. Like today they are doing the fasting, in the next day they will do the after breakfast blood glucose, then they will do the before lunch blood glucose, then they will do after lunch on the next day. So on the different days they do different blood glucose levels. So we will get a clear picture at what time the blood glucose is getting high, at the what time blood glucose is getting low. So insulin as well as meal can be titrated. Insulin can be titrated according to that, and meals can be planned according to that, modified according to the glucose readings. So it will achieve a better glycemic control rather than doing only fasting blood glucose daily or weekly. So in addition to that, if the patient develops symptoms of hypoglycemia, patients can check the blood glucose at home during that time of the day, and they can do early intervention. They can eat at that time some meal that has some sugar content, like they can take some juice or other things, and so that serious hypoglycemia can be preventive. So it is very good therapeutic tool. In addition to that, it is a very good education tool. The patients can also see how their blood glucose are changing with the change in the insulin dose, how their meal is affecting their blood glucose level. So the patients can be sensitized to the behavior modification according to their blood glucose levels, so that in the future they achieve a better glycemic control. So home monitoring is very important therapeutic, preventive as well as educational tool for these patients who are on the daily insulin doses.
All right. Now, Dr. Mondal, let's talk about obesity, which is probably the most important factor in the development of insulin resistance. And can weight loss reverse insulin resistance?
Okay, so yes, when we are talking about the most common type of diabetes, type 2 diabetes, the key factor behind occurrence of type 2 diabetes is insulin resistance. That is, insulin is secreted in your body, but it does not act. And if you are looking at the most important factor behind the occurrence of insulin resistance per se, it is obesity or excess of fat tissue. So with excess consumption of high fat food, with a sedentary lifestyle, there is a pandemic of obesity across the world. And with increased obesity, that is when you are having an excess of fat tissue or adipose tissue in your body, this becomes the seat of inflammation, of oxidative stress. And also, these fat cells produce something known as adipokines, which are very important for glucose homeostasis. So with excess of fat tissue, there is an oversecretion of the bad adipokines. And all of these factors, these adipokines, the inflammation, the oxidative stress, go on to prevent the action of insulin. And there is a resistance to the action of insulin. Now, with weight loss, this becomes the key to the improvement of insulin resistance. In fact, those who are having borderline high blood glucose levels, which we call as pre-diabetes, with a good amount of weight loss, many of them can very well be normoglycemic. They will not progress to go on to having diabetes. Also, it has been seen in the recent years that those who are in the early stages of type 2 diabetes mellitus, even if they can lose a good amount of weight, there can be an improvement in their insulin resistance, and there can be a remission of their diabetes mellitus. Also, there are so many other insulin resistance related disorders like polycystic ovarian syndrome, like non-alcoholic fatty liver disease, and all of these, to a great extent, they can be reverted with the correction of insulin resistance with weight loss.
Right. Dr. Solomon, if you could tell us, is it possible to reverse diabetes when you start insulin therapy as soon as you're diagnosed with it?
We generally try to avoid the term reversal of diabetes, because many times it might sound like a permanent cure or just give the feel that diabetes is gone forever. So rather we use the term remission of diabetes, which is exclusively for type 2 diabetes that we talk about. Now, what do we actually mean by a diabetes remission is that the blood glucose levels are well within the diabetes, below the diabetes range, and without the need of medications to bring down the blood glucose. Now, diabetes remission is very much possible, especially in younger individuals, and especially in patients who have been newly detected to have type 2 diabetes, or probably recently detected to have type 2 diabetes within maybe a year or two. These are the group of patients who would really benefit when they really attempt towards achieving a diabetes remission. Now, the diabetes remission per se is mainly driven by weight loss, as already mentioned by Dr. Mondal. So this weight loss has to be achieved by several modes. It is not just by swallowing a pill or taking a shot, but by dietary modification, good regular physical exercise, reducing the stress, getting a good sleep, and several other behavioral change that can help towards achieving the diabetes remission. Now, as with these interventions, the main thing or the main mechanism how diabetes goes in for remission is that it gives some rest to the pancreas and to the beta cells that produce insulin, and therefore it allows the pancreas and the beta cells to recoup and bounce back with their normal function and the normal insulin production. So this is how we try to achieve diabetes remission in patients with type 2 diabetes. Now, having said that, apart from the lifestyle modifications, which I had already mentioned, there are medications like metformin, group of drugs like GLP-1 analogs that can help in this process of achieving diabetes remission in patients with type 2 diabetes. Now, insulin therapy per se has some role in terms of achieving diabetes remission. Though insulin therapy quite early in the stage of diabetes or at the time of diagnosis is mainly decided based on the clinical presentation of the individual, the glucose profile of the individual, and when we determine if that patient would really benefit from insulin therapy. Now, insulin therapy has shown to have some benefit in achieving early diabetes remission just because of the mechanism which I already mentioned, by giving the pancreas some rest. Now, having said that, we do not have any recommendation to give insulin to each and every individual in order to achieve diabetes remission. But overall, it has to be done with a multidisciplinary approach of checking your diet, doing a good exercise, stress reduction, medications, and insulin, if really warranted for that given individual, will be determined by the treating physician. So though type 2 diabetes remission is possible, not every patient would be able to achieve it, but working towards remission is definitely going to be rewarding.
All right. Well, thank you so much, doctors, for talking to us and explaining to the viewers these various questions around diabetes management and the use of insulin. Thank you all for watching at home. Goodbye.